Hello, my name is Gina Hackenberg, and I'm a vocational rehabilitation counselor with Paralyzed Veterans of America. Today, I want to talk to you about Social Security disability, unraveling the mystery, understanding how the ticket to work process operates. There's a lot of myths that you'll hear about Social Security disability, including that your cash benefits will end immediately upon trying to work. You'll lose your health and Medicare, Medicaid benefits as well, and you'll be under close scrutiny for continuing medical disability reviews right away, which will also lead you to lose your benefits. So we're going to talk today about dispelling these myths and the ways that you can feel safe exploring employment. First, I want to define what an employment network is. The Social Security Administration has evaluated, screened, trained different organizations across the country to be employment networks and administer the Ticket to Work program in your community. So if you receive SSDI and you're age 18 through 64, you should be eligible to participate in Ticket to Work. There's not an actual paper ticket. You just verbally or in writing via an email or sign a piece of paper stating that you'd like this employment network to assign your ticket to them and assist you with the Ticket to Work program. Getting started, you'll develop an individual plan for your goals towards employment with that employment network. And within that plan can be a variety of services that they'll assist you with, ranging from identifying your skills, setting work goals, preparing for job search, filling out job applications, making resumes, preparing for interviews, and that transition to work. This could also include job accommodations, identifying those, explaining how to ask for them, where to get them, as well as maintaining your job for the long term. To feel comfortable with testing the waters, Social Security has developed 5 major work incentives that an employment network like PVA can assist you with. They're listed here. They can be a little confusing, so I tried to give a general overview of each one. The one most people have heard about is the trial work period, which is the first 9 months that you work and earn over a certain trial work level. Currently, it's $940 a month. That will trigger that month counting as a trial work month. Now, there's no limit to how much you can earn during those months. Your cash benefits, your healthcare benefits, everything will remain exactly the same during those 9 months. There will be no penalty. Now, after this 9 months, you can look at another work incentive, which is called impairment-related work expense. Basically, you are deducting a portion of those expenses from the amount that you earn, perhaps lowering it to a level that will allow your cash benefits to continue that month. But these are things like medication, wheelchair, a service animal. And this is an area that the employment network can help you calculate. It's not exactly a dollar for dollar. It's more like a formula or percentage of these expenses. The third area is called expedited reinstatement. And within 5 years of your cash benefits stopping because of work, you can reapply apply for reinstatement instead of starting the entire process over again. Perhaps you have an exacerbation of your disability, or you have to go into the hospital, or you're just unable to work for some reason during that 5-year period. You can apply for expedited reinstatement instead of starting the entire process over again. They're going to give you 6 months of these benefits while they're processing your reinstatement application. So you shouldn't have to wait to have those benefits start again. It's a much faster process. The fourth work incentive is called an extended period of eligibility. And I call this really filling in the gaps. So let's say you go to work and you pass the trial work period and you're doing well. But 1 month, you simply have to go to the hospital for a couple of weeks. You're just not able to earn the level that you were before. You're not able to work that month. Well, if it's within the first 3 years of that employment, Social Security can fill in that gap for you and give you the cash benefit from SSDI during that month that you could not work. And then when you go back to work, the cash benefit will stop again and you'll continue on as before. So that's a really nice safety net. The last one on the list is called Protection from Medical Continuing Disability Review. A lot of people, as we mentioned earlier, think they're going to be under the microscope and have more reviews if they join Ticket to Work, but it's actually the opposite. If you're making progress and fully participating, they will actually suspend those reviews. Medicare coverage also continues during the trial work period. There should be no change there. There are other work incentives that allow the coverage to continue up to 93 months after your trial work period. They are pretty technical and different types, so I'm not going to go into full detail here, but they do exist that can allow those Medicare and Medicaid benefits to continue for up to 93 months. Follow through. I greatly encourage everybody to follow through with reporting your income to Social Security. I've heard many people say, well, they're the government. They know how much I make. They're going to know what my income is. And truthfully, they will eventually, but if you're not reporting it timely each month, they may find an overpayment years later, and then you are in a tough spot. So it is listed as a responsibility that you report your income each month, any change. Now, it may not affect your benefits. You may only earn $300 a month. That's not going to trigger a trial work period. It's not going to stop your cash benefits. But if you get into the practice, either by mail or visiting an office or calling, and even through an online account called a myssa.gov account. But it is 100% your responsibility. Even if you're working with an employment network, they may track your pay stubs as well and assist you with understanding and navigating your benefits. But you are the one that has to report your income and not assume that anybody else is going to do it for you. But if you do that and work with your EN closely, you're going to be ahead of the game. You're not going to be surprised by an overpayment or benefit stopping. You're going to be prepared for that. And that's the best way to go. Thank you. We've got a resource slide here. Choosework.ssa.gov is the Social Security website for the Ticket to Work program, and they have a whole lot of information. Success stories, fact sheets, webinars, tutorials. So it's all there, but I really encourage you to work with an employment network because it's hard to process it all, understand it all, and how it applies to your case individually. But it is a wonderful resource to have while you're working with the employment network. There are also two other types of organizations that can be authorized by Social Security. One is called a PABS, Protection and Advocacy for Beneficiaries of Social Security, and also the Work Incentives Planning and Assistance, which is called WIPA. These two are specially trained to offer free services to you as well under this program to make sure you're understanding how your benefits are supposed to be affected. And if you have a question or concern about how something was done, these organizations can help, along with the employment network, to make sure that you're protected and understand how your benefits are affected. So thank you for joining me, and definitely research and join with an EN if you're considering going back to work. It can be extremely fulfilling, and you have a lot of protections from the work incentives to make sure you do it safely. Thank you.
Since Since 1946, PVA has been the leading advocate for veterans with spinal cord injuries and diseases such as MS and ALS. We help all veterans with disabilities by helping with earned benefits and specialized health care, education and career resources, adaptive sports, housing and legal assistance. Learn more at pva.org.